maltreatment. But now we need to turn our attention to actually recognizing some of the signs of physical abuse. Betsy, can you lead us through this?
Sure, I would like our future foster parents to understand that they might discover the signs of maltreatment on a newly arrived child or a child returning from birth parent visits. In most states, it is mandatory for foster parents to report concerns of abuse to your agency. The following slideshow presentation will help you recognize some signs of abuse. Some of the slides are graphic and might be difficult to view, especially if you have been a victim of abuse. If you anticipate having a problem viewing the slides, stop the program immediately and contact your agency. These slides are being shown now to familiarize caregivers with the physical symptoms of child abuse and neglect, such as bruises and burns. Please be prepared. Some of the slides may be disturbing. However, caregivers must be able to differentiate accidental and inflicted injuries. Information provided by caregivers to social workers may ultimately protect children from future injury. Bruises. Bruises are a common symptom of child abuse. However, children often become bruised during normal play and activity. Caregivers must be able to differentiate between accidental and inflicted bruises. Accidental bruises are usually on bony parts of the body, knees, elbows, shins, forehead, and hips. Bruises from abuse are often on soft body parts, cheeks, fleshy parts of arms and legs, and torso. Multiple bruises on different parts of the body in different stages of healing also often suggest abuse. Bruises on buttock. The child in this slide has been paddled. Bruises on the buttocks and lower back are frequently related to spanking and physical punishment, which is an inflicted injury. This slide shows a child who was spanked excessively, probably with something other than a hand. Bruises on the face. Bruises on the face, cheek, or earlobe are often the result of having been slapped or cupped. The redness and swelling of the bruise indicates that this child has a fresh slap mark on the cheek. You can see the outline of 3 fingers. A handprint is almost always an inflicted injury. Bruises in and around the mouth. Bruises both inside and outside the upper lip are usually caused by a bottle forced into the child's mouth, possibly in a desperate attempt to quiet a screaming baby. Bruises in this area of the face cannot be accidental until the child can sit up by himself and inadvertently fall forward around 6 to 8 months of age. Bruises on the extremities. This child has bruises on the upper and lower arm that have been left by a human hand. These are grab marks or squeeze marks. The oval-shaped marks on the child's arm are actually fingerprints from being forcibly held during violent shaking. With grab or squeeze marks, there are generally more than one in an area. Human bite marks. This child has at least 6 human bite marks on his back. Note that the marks are distinctive, paired, crescent-shaped bruises with individual teeth marks. It can be determined if the bite marks are made by another child or an adult by the size and number of individual tooth marks. A dentist can best make this determination. Bruises made by objects. Many times, bruises may be caused when children are hit with objects such as belts, straps, wooden spoons, fly swatters, or other household items. This child was hit by an electrical cord, as seen by the loop marks on the back. These types of injuries can produce lifelong scarring. In summary, bruises are a common symptom of child abuse. Bruises on soft areas such as the buttocks, upper arm, cheek, neck, thigh, etc. are suspicious, while bruises on the bony protrusions such as knee, shin, chin, elbow, and forehead are common sites of accidental injuries. Burns. The most common non-accidental burns are inflicted by a cigarette. These burns are deep, circular, and are of similar size. The burns you see on this child's hand were caused by a cigarette being held against the child's skin. It is unlikely that a child would willingly hold his hand on a hot cigarette or coal long enough to cause this type of injury. Immersion burns. This is a difficult slide to view as this type of injury is particularly painful. This child was burned when she was made to stand in excessively hot water. This is known as a stocking burn. When children are burned accidentally by hot liquids such as water, soup, or coffee, there are always splash marks which are irregular. This suggests that the burn was probably accidental. Inflicted burns made by hot liquids may be found on the hands, feet, buttocks, and genital areas. Immersion burns usually have clear lines that mark the edge of the hot water or liquid. To summarize, burns are painful injuries. Consequently, when children are burned accidentally, the injury will demonstrate the child's attempt to avoid the injury, such as splash marks, unevenness of the burn, etc. Burns which clearly outline the hot object, and burns on the neck, back, buttocks, and genitals are suspicious.
Some inflicted injuries are difficult to spot. Injury to internal organs, head injuries, some fractures, and neglect are often overlooked until the child's condition becomes critical.
Several times, as indicated by the multiple bruises on her forehead. What you cannot see are the many blood clots called subdural hematoma on her brain, nor can you see the possible skull fracture. 1/4 of children with this type of head injury die, and the majority of the survivors have mental retardation, blindness, cerebral palsy, and/or seizures. Children should never be hit in the head or face, or be shaken, as the risk of injury is very high. Any head injury should be evaluated by a physician as soon as possible. Other symptoms of head injuries are black eyes, difficulty breathing, irritability, vomiting, decreased level of consciousness, and/or seizures. Abdominal injuries. We will now look at inflicted abdominal injuries. Intra-abdominal injuries are the second most common cause of death in battered children. The abdominal organs are not well protected. The abdominal wall is usually relaxed, and the energy from a blow is totally absorbed by the internal organs. The injuries are usually caused by a punch or kick to the abdomen that compresses internal organs against the spinal column. The most common injuries are to the liver and the spleen, the small or large intestine, or the pancreas. Kidney injuries can result from blows to the back. While bruises on the abdomen can sometimes confirm injury, in over half the cases of internal injuries, there are no visible bruises or marks on the outer abdominal wall. Anytime a child presents symptoms of internal injury, child abuse must be considered. This 4-year-old boy had symptoms of vomiting and gastrointestinal obstruction. The child received a blow to the stomach area but showed no outward bruising or abrasions. He was diagnosed as having an intramural hematoma of the intestinal tract. Workers should be sensitive to any child who may be nauseous or complain of inner pain with an inability to have a bowel movement. Broken bones. Many children experience a broken arm or leg during childhood play and activity. However, over 20% of children who have been abused have X-ray evidence of bone injuries. This chest X-ray of a 3-month-old boy shows many healing fractures pointed out by arrows. Rib fractures are quite common in young infants who have been squeezed violently in an attempt to silence them. This child also has a fracture of the shoulder blade and a well-healed fracture of the right collarbone. This indicates that this child was injured on 3 separate occasions. These injuries are nearly impossible for a child this young to receive accidentally. To summarize, accidental bone injuries from falls or accidents appear different from inflicted breaks, which are often the result of wrenching, twisting, or force. X-rays can confirm or dispute an explanation of the circumstances which led to the injury. Failure to thrive. Failure to thrive can best be described as a very underweight baby. This child has very little fatty tissue. You can see that the child's ribs are protruding, the buttocks are very thin, the skin is wrinkled, and the arms and legs are spindly. This child is 3 months old and has only gained 1 ounce since his birth. Failure to thrive is caused by underfeeding in 50% of cases, which is the type social workers are most concerned about. Another 20% of cases have failure to thrive due to an error in feeding, while 30% have a health problem interfering with nutrition. Prolonged malnutrition is very dangerous in infants. It can lead to permanent mental retardation, stunted physical growth, as well as death from starvation. This is a facial view of the same child. You can see he has a pinched-looking face because of the absence of fat deposits in his cheeks. These children often gain weight rapidly when they are provided unlimited amounts of a normal diet for their age. Caregivers must be patient and flexible in order to assist the child in accepting nutrition. This is a picture of the same child after approximately 2 weeks in the hospital. He has gained 2 pounds and has also become a much happier child. This is a full body view of the same baby after having received full nutritional treatment. In many babies where failure to thrive is pronounced, adequate feeding will result in an impressive weight gain. In summary, failure to thrive is indicated by a severe underweight condition caused by underfeeding, improper feeding, or a medical problem. Patient and flexible caregivers are critical to the recovery of the child. Proper nutrition can lead to a steady weight gain and a complete recovery.
An isolated injury is worth noting, but may not be a sign of abuse. If these symptoms show up again, or if there are other signs, please discuss your suspicion with a caseworker.
Those are horrible marks. Will all foster parents encounter these types of injuries on their future children?
Not necessarily, but it can be one of the challenges of being a foster parent. We want all of our future foster parents to be prepared and understand how to spot marks of abuse.
I noticed that most of the slides we just watched focus upon physical abuse. These are very disturbing images, but are there signs of neglect that our foster parents should be aware of?
Yes, I have prepared some handouts which list and explain signs of neglect and additional signs of physical abuse. It's important to note that the existence of one sign or symptom alone may not conclusively pinpoint that the child is being abused. Generally, if these symptoms show up time and again, or if they appear together, the level of suspicion on your part should prompt you to consider the likelihood of abuse, and you may need to take action by reporting your suspicions to the authorities.
Thank you. That leads us to the next section about reporting incidents.
Laws about abuse and neglect differ from state to state, but every state has mandatory reporters of suspected child maltreatment. Foster parents are mandatory reporters.
Okay. Let's say we have identified some questionable marks on the child. Betsy, aren't there requirements and regulations and procedures about foster parents reporting suspicious marks of abuse?
Yes, the laws vary from state to state. In general, though, foster parents clearly must report any observed or suspected child maltreatment to law enforcement or to the Child Protection Unit and/or to their caseworker. What is important to know are the legal statutes in your state and the child's custodial state about mandatory reporting of child